So I'm Francisco. I'm originally from South America, Ecuador. I was born over there. I was raised there. I went to medical school in Ecuador to the Catholic University. When I finished my medical school, my passion has always been surgery, and my intention was to do surgical training. At that point, I decided that I was going to start my surgical training in Canada. So I went into Canada to pursue my surgical training, learned English at the same time because I didn't have a good base of English. And at that point, I realized that pursuing a surgical training over there was not doable. I was fortunate enough to be able to come to the United States. When I originally got to the United States, I went to Tampa, Florida, the place where I took my boards to be able to earn the MD degree here. After that, I moved to Miami, where I did some research and followed that with my surgical training at the University of Tennessee, East Tennessee State University. I completed surgical training there for about 6 years, and then I went down to Miami again to pursue a bariatric surgery fellowship. How did I end up doing a bariatric surgery fellowship is because during my residency training, I saw the dramatic difference in the quality of life of patients that had pursued bariatric surgery before. It wasn't about how many pounds they lost, but how much quality of life they actually gained. I saw patients going from wheelchairs to being able to walk. I saw patients using home oxygen and up to 20 medications that now only take multivitamins as their own medication. At that point, I decided that for me, what I want to do is create a real change in life for a patient and not just do surgery. At that point, I pursued my fellowship. During my fellowship, I learned a lot of the psychological aspects and the physiological aspects that come along with bariatric surgery. When I finished my fellowship, I contemplated going to many different jobs. And one of the things that I always wanted to be able to do is I wanted to be able to provide for my patients what I wanted to provide, not what the institution made me provide for them. What I was looking for is a place that will address not only the physical aspect, but also the mental, nutritional, and exercise aspect of the treatment. At that point, I found the practice where I'm at. I joined Dr. Blaney into the practice. I fell in love with what we do. I have a very strong belief that the problem with obesity is not a physical problem, it's also a mental problem. And unless we address both of them, the success is not going to be very high. I love the way we do things. We see the patient as a whole. We treat the patient as a whole. The psychological aspect, the nutritional aspect, and we also can provide the surgery that gives them the tool to jumpstart their journey. I change lives every day. That's what I love about my career. I see lives being changed every day from my partners as well. And that's what I love about what I do. Every time that I go to clinic and I see a patient that has lost a tremendous amount of weight and then tell me what they have gained by losing is what promotes me to get up every morning and do what I do. My passion is I love dieting and exercising. I love the psychological aspects of exercise. I have done a lot of research on how exercise doesn't only improve your physical abilities, but also your mental abilities, and more than anything, emotional stability. And my passion is doing research about it and being able to help the patients with that aspect as well. Most remarkable patient that I remember is a patient who weighed almost 700 pounds, had severe heart failure related to his weight, diabetes, high blood pressure. He couldn't move. He mobilized himself on a scooter and using oxygen. After surgery, with the help of the surgery and his determination, he has been able to get off the oxygen, off the scooter, off the medications with a functional heart. And now he actually enjoys running 5Ks. And he's actually become quite good at doing that. Another patient that probably is also one of the most remarkable patients is a lady that when came to me, she had a very low autoesteem. She truly didn't believe that she could do anything. She was emotionally very hurt. During the surgical process, along with the psychological help of our psychologist, and after performing the surgery, she's been able to completely flourish. She turned herself from a patient that was very emotional and unstable to being a person who has underwent a career in finance, and now she's a financial advisor with an extraordinary success. And she has furthered her career right now, actually joined a national brand of financial advisors. As a practice, what do we want? We have the strong belief that patients come first. Our success is our patient's success. We would not be able to be who we are, nor do what we do if it would not be for patients. So within what we believe and how we act is based on what our patient needs are and how we can better provide that for them. I invite anyone that wants to explore our practice to either go to the webpage or come see us, because we'll be more than happy to receive you and show you who we are. One of the things that excites me the most every time that I'm in clinic is when I hear how happy patients are after losing the weight. It's very rewarding for me, for them to see a change and all of a sudden they are happy. So I like to say that we build happiness for them.